Have you ever suddenly felt a sharp pain in your lower abdomen and wondered what it could be? Abdominal pain, that unpredictable guest, can knock on our doors for many reasons, ranging from something as benign as a bout of indigestion to as severe as appendicitis. Picture this. You're going about your day when a sudden, intense pain strikes you in the lower right side of your abdomen. This area, a common site of discomfort, might initially be brushed off as a simple stomachache or perhaps a muscle strain. Yet the persistence or escalation of this pain should not be taken lightly. Abdominal pain can be a complex puzzle. It might be caused by issues as varied as kidney stones, gallbladder problems, or a urinary tract infection. However, if the pain is sharp, persistent, and increasingly intense, it's crucial to consider appendicitis, a condition that, while common, is often overlooked until it becomes a serious threat. Stay tuned as we delve into the symptoms of appendicitis, a common yet often misunderstood condition. First, what exactly is appendicitis? Appendicitis is the medical term for when the appendix becomes inflamed and swollen. The appendix itself is a small, finger-shaped pouch that projects from your large intestine on the lower right side of your abdomen. Though its exact function in the body isn't fully understood, it's known to be a part of the immune system in some capacity. The trouble begins when the appendix becomes blocked, either by stool, a foreign body, or even cancer. Blockage can also occur due to infection, since the appendix can swell in response to any infection in the body. This blockage leads to increased pressure, decreased blood flow, and inflammation. If not treated in time, the appendix can rupture, releasing bacteria into the abdomen, a potentially life-threatening situation. The inflammation caused by appendicitis typically results in pain that begins around the navel and then shifts to the lower right abdomen, a classic symptom of this condition. Understanding this can help us better recognize the symptoms, which we will explore next. Appendicitis often starts subtly. What should you look out for? When it comes to appendicitis, the initial signs can be deceptively mild. It typically begins with a dull pain around the navel or the upper abdomen. This pain might not seem alarming at first, mimicking less serious issues like indigestion or a simple stomachache. However, the true nature of the pain associated with appendicitis is its tendency to change. As hours pass, this discomfort tends to migrate towards the lower right abdomen, a hallmark movement that sets appendicitis apart from other gastrointestinal complaints. What starts as a general discomfort can suddenly localize and sharpen, becoming more intense and hard to ignore. This progression is not just a shift in location, but also in intensity and quality of pain. During this early phase, other symptoms might begin to surface, subtly enhancing the pain's narrative. Nausea or an inability to eat without discomfort often accompanies the pain. There might also be a slight fever, not high enough to cause alarm, but certainly out of the ordinary. These signs, combined with the migrating pain, create a pattern that medical professionals often recognize as indicative of an inflamed appendix. It's crucial to understand that this pain doesn't behave like typical stomach aches. It can intensify during movement, whether it's something as simple as walking or as sudden as a cough. The pain might also become disproportionately severe compared to the initial mild discomfort. This is why appendicitis can easily be mistaken for less severe conditions like constipation or gas, especially during its early stages. Remember, the body is equipped with various ways to signal distress, and the shifting nature of this pain is a prime example. It is the body's way of pointing to a specific problem that needs attention. If the pain shifts and intensifies, it's a critical signal not to be ignored. As appendicitis progresses, other symptoms join the fray. This escalation can often blur the lines between a simple stomach upset and a potentially serious condition. As we delve deeper, let's explore how these additional symptoms manifest and why they can be misleading. When the inflammation of the appendix worsens, the body reacts in several ways. Nausea and vomiting are common responses. These symptoms are the body's attempt to rid itself of what it perceives as harmful. However, because nausea and vomiting are also common in many less serious conditions, like gastroenteritis or food poisoning, it's easy to dismiss them as just another stomach bug. Another significant symptom is the loss of appetite. When the body is fighting an infection, such as the inflammation caused by appendicitis, it often shuts down less critical functions, like hunger, to conserve energy for the immune response. A person might not feel like eating, which again, could easily be mistaken for a reaction to something they ate. A low-grade fever is yet another companion in the array of symptoms linked with appendicitis. Typically, The body temperature might hover around 100 degrees Fahrenheit, a subtle sign that the body is battling an infection. Yet, because a slight fever can be attributed to a myriad of conditions, it's often overlooked or inaccurately attributed to a viral infection. The deceptive nature of these symptoms can often lead individuals to underestimate the severity of their condition. It's not uncommon for someone to wait it out, hoping the symptoms will pass, attributing them to something less severe. This underestimation can delay the crucial medical intervention required to treat appendicitis effectively. Understanding the interplay of these symptoms, nausea, vomiting, loss of appetite, and a low-grade fever, alongside the initial signs of abdominal pain, can provide critical clues that what might seem like a common stomach ailment could be something far more severe. Recognizing the combination of these symptoms is key to identifying appendicitis early. What happens when appendicitis symptoms are overlooked? This is a crucial question, as recognizing the progression from mild to severe symptoms can literally save a life. When appendicitis is not diagnosed and treated promptly, the inflammation worsens. Initially, a person might just feel discomfort, but as the condition escalates, severe symptoms emerge. One of the most alarming is a significant increase in body temperature. Fever that climbs higher than 100 degrees Fahrenheit is a red flag that the body is fighting a severe infection. The pain, initially localized around the lower right abdomen, becomes more intense and can spread across the entire abdominal area. This isn't just a typical stomach ache. The pain associated with advanced appendicitis can be so severe that it becomes debilitating, making even simple movements like walking or coughing excruciatingly painful. Another critical symptom to be aware of is the appearance of a rigid, hard belly. This symptom indicates that the appendix might be at the brink of rupturing or has already ruptured, a condition known as peritonitis. This is when the infection spreads throughout the abdomen, a dire medical emergency that requires immediate attention. Ignoring these symptoms can lead to the appendix bursting, a complication that dramatically increases the risk of widespread infection and can be life-threatening. The contents of the ruptured appendix can spill into the abdominal cavity, leading to peritonitis, which can cause severe inflammation across the abdominal lining and potentially infect the blood, a condition known as sepsis. Both peritonitis and sepsis are medical emergencies and can be fatal if not treated swiftly and effectively. The key takeaway here is the importance of not dismissing ongoing or worsening symptoms. The body often knows when something is wrong and communicates through pain and changes. Listening to these signals and seeking medical advice promptly can prevent the severe consequences of an untreated inflamed appendix. Ignoring these signs can lead to critical situations, which is why awareness is paramount. Many people confuse the symptoms of appendicitis with other ailments. It's an easy mistake given how varied and deceptive these symptoms can be. One common misconception is that appendicitis pain must start on the right side. In reality, the pain can begin around the stomach or the entire abdomen, making it easy to dismiss as a minor digestive upset. Another area where confusion often arises is with gastrointestinal issues, such as gastroenteritis. Symptoms like nausea, vomiting, and abdominal cramping are common to both conditions. This overlap can lead healthcare providers down the wrong diagnostic path, especially if a clear history isn't provided. Similarly, appendicitis can mimic a urinary tract infection. Both can cause pain in the lower abdomen and a frequent urge to urinate. Without proper imaging tests or a thorough examination, it's not uncommon for initial diagnoses to miss the mark. This variability in symptoms underscores the importance of a careful and comprehensive medical evaluation. Knowing the full range of possible symptoms helps distinguish appendicitis from other conditions. So, when should you actually seek medical help? Dealing with abdominal discomfort can be tricky. Often it's easy to dismiss it as a minor issue. However, if you're experiencing a combination of symptoms such as persistent abdominal pain, especially in the lower right side, fever, nausea, and loss of appetite, it's crucial to consult a healthcare provider immediately. These symptoms, when found together, could be indicative of appendicitis, a condition that requires prompt attention. Why the urgency? Appendicitis can lead to severe complications if not treated in a timely manner. The inflamed appendix could rupture, leading to an infection that spreads throughout the abdominal cavity, a life-threatening situation known as peritonitis. Remember, the body has unique ways of signaling that something is amiss. Ignoring these signs can lead to greater risks. Therefore, if you suspect that what you're experiencing could be more than just simple stomach upset, don't wait. It's always better to be safe and get checked by a professional. Let's quickly recap the key points about recognizing appendicitis. Appendicitis is a serious medical condition where the appendix becomes inflamed and, if not treated promptly, can rupture. It often starts with a subtle pain around the navel, which gradually shifts to severe pain in the lower right abdomen. This hallmark shift is crucial in distinguishing appendicitis from other abdominal issues. Early signs include this migrating pain, followed by nausea, loss of appetite, and a low-grade fever. As the condition progresses, the symptoms intensify, pain becomes sharp, and movements like walking or coughing can exacerbate it. Ignoring these signs can lead to severe complications, such as a ruptured appendix, which is a medical emergency. It's critical not to dismiss these symptoms or confuse them with less severe ailments. Listening to your body and seeking immediate medical advice upon experiencing any of these symptoms is paramount. Remember, understanding and acting on these symptoms can truly be a lifesaver. Thank you for watching and take care of your health.